Greetings and welcome to my podcast. Thank you for tuning in. I'm Dr. Andrea Walker, family nurse practitioner. In today's episode, we will discuss the popular GLP-1s, Ozempic, Wegovy, Semaglutide, and GLP-1/GIPs, Mounjaro, Zepbound, and Tirzepatide. And just so you know, technically they all are GLP-1s. However, Mounjaro, Zepbound, and Tirzepatide are also GLP-1s and GIPs. I just tend to call them all GLP-1s. But today we're going to talk about a term you may or may not have heard, but it will give some insight as to why some people struggle with losing weight on the GLP-1s and GIPs. With that being said, the topic for today is GLP-1 resistance as well as gut health. So let's get started. What exactly is GLP-1 resistance? GLP-1 resistance refers to the body's reduced responsiveness to this hormone. This means that the receptors for GLP-1 are less responsive or that the signaling pathways downstream of the receptors are impaired. As a result, the beneficial effects of GLP-1 on blood sugar control, appetite regulation, and weight management are diminished, leading to slow or no weight loss while on the GLP-1 medications. I will have to go over some background information before diving into the meat of the matter. So let's talk about gut health first. The term gut microbiome or microbiota refers to the microorganisms living in our intestines. Each person has about 200 different species of bacteria, viruses, and fungi in the digestive tract. While some are harmful, others are actually very beneficial to our health. Gut health is important to our overall health, so you want to have a healthy gut. Our diet is one of the main driving factors in shaping our gut microbiota or microbiome. However, when the gut microbiota dysbiosis occurs, GLP-1 resistance can occur. I know those are fancy terms, but let me break it down for you in simple terms. Basically, dysbiosis is when your gut becomes unbalanced and is no longer as healthy as it should be, hence causing a potential resistance to the GLP-1 hormone. So this is why some people do not see any weight loss at lower doses, or they may not see weight loss until they get to higher doses. In some cases, GLP-1s just may not work for them at all. Their resistance may be so severe that unfortunately, these medications just simply won't work for them or won't work well for them. So, how do you know if you have an unhealthy gut? I will now discuss 6 common symptoms of people with an unhealthy gut, and then I will get back to GLP-1 resistance, but the two are very much interrelated. Number 1, upset stomach. People with an unbalanced gut tend to have an upset stomach more than usual. And I'm not talking about due to being on the injections. A balanced gut will not have many problems processing foods and eliminating waste. Number 2, people who eat a high sugar diet and processed foods. Eating a lot of processed foods and adding sugar can decrease the amount of good bacteria and healthy diversity you want in your gut. Number 3, they have unintentional weight loss alternating with weight gain. An impaired gut can impair your body's ability to absorb nutrients, regulate blood sugar, and tend to store fats more than it should. Number 4, sleep disturbance or constant fatigue is a sign of an imbalanced gut. Then number 5, autoimmune conditions. Diagnoses like rheumatoid arthritis, lupus, or celiac disease, just to name a few. Individuals with these conditions can be more prone to having an unhealthy gut. An unhealthy gut can lead to increased systemic inflammation and alter the proper functioning of one's immune system. And then number 6, food intolerance. People who have difficulty digesting certain foods and who are unable to tolerate them tend to have an unbalanced gut. So, taking a prebiotic or probiotic is definitely not a bad idea. Other ways to try to overcome GLP resistance, besides improving your gut health and adding in a pre or probiotic, would be to work out. According to research, exercise increases the diversity of the gut microbiota and alters the composition of the microbiota in a beneficial way. Moderate to high intensity exercises have been known to increase GLP-1. So, as I always stress, make sure to get some workouts in regardless, but especially if you are on one of the GLP-1s and the scale just doesn't seem to be moving hardly at all on any dose of the medications. GLP-1 resistance is also caused by excessive visceral fat. So, of course, that means work out and improve your diet. Lack of physical activity is a risk factor for the accumulation of visceral fat. Now, let me address this. Not everyone's lack of losing weight will be due to GLP-1 resistance. I want to be clear. Some people are not losing the weight they want to see for reasons outside of GLP-1 resistance. Those are things like genetic differences. Individual genetic makeups can influence how well a person responds to GLP-1 medications. Some people may have genetic variations that affect the GLP-1 receptor or related pathways, making the drug less effective. And then there's lifestyle factors. Diet, exercise, and other lifestyle habits can impact the effectiveness of the GLP-1 medications. For example, someone who continues to consume a high-calorie diet may not see the same benefits as someone who also adopts healthier eating habits. And then underlying medical conditions. Now, this is different than what I talked about earlier, but things like PCOS, other hormonal imbalances, they can make weight loss more difficult. And in some cases, yes, a higher dose of GLP-1 medication might be necessary to see any significant weight loss results. But generally, the medication will work. And then adherence to medication. The effectiveness of GLP-1 medications depends on consistent use. If someone is not taking the medication as prescribed or stops using it prematurely, they may not experience the full benefits. This is a big one that I see. This is not GLP-1 resistance. This is actually more so non-compliance. Big difference. And then now, drug tolerance. Over time, some individuals may develop a tolerance to the medication, leading to reduced effectiveness. This can definitely happen. This can happen if the body adjusts to the presence of the drug, requiring higher dose to achieve the same effect, which is different than being GLP-1 resistant. This just means you need to go up on the dose. And then psychological factors. Mental health plays a role in weight management. Stress, emotional eating, or other psychological issues can counteract the benefits of GLP-1 medications, making them less effective in some individuals. And then, of course, individual metabolism. Metabolic rate varies from person to person. Individuals with a slower metabolism may require higher doses of GLP-1 medications to see significant weight loss because their bodies may not respond as strongly to the appetite suppressing and metabolic effects at lower doses. Next is body composition and weight. Individuals with higher body weight or more significant fat mass might need a higher dose for the medications to exert its full effects. Larger individuals may require more medication to achieve the same therapeutic concentration in their bodies compared to someone with a lower body weight. And then receptor sensitivity. The sensitivity of GLP-1 receptors can vary. Some people might have less sensitive GLP-1 receptors, meaning they may need a higher dose of the medication to achieve the same level of receptor activation and consequently the same clinical effects. This is why some people can stay at super, super low doses of the medication for a long time and lose weight. But then some people have to go all the way up before they really see significant weight loss. But it doesn't mean that they are GLP-1 resistant. It has to do with the receptor sensitivity. And then diet and lifestyle factors. I kind of talked about this, but a person's diet, level of physical activity, and other lifestyle factors can influence how effective GLP-1 medications are. So just make sure you're eating right, make sure you're getting your exercise in. I cannot stress this enough. I see it all the time in my clinic when I tell my patients to increase their protein, kind of lower their carbs, and I don't really promote a keto carb diet, but just eat healthy carbs and don't eat a ton of them. But you have to have carbs. So I do want you eating carbs, but just the healthy ones. But whenever they increase their protein, they always see weight loss. I want you eating a balanced diet, but it works. And then the last one, degree of insulin resistance. People with higher levels of insulin resistance, often seen in conditions like obesity or type 2 diabetes, may not respond as effectively to lower doses of GLP-1 medications. A higher dose might be necessary to overcome this resistance and achieve the desired effects of blood sugar regulation and appetite. And that's kind of to be expected. In cases of true GLP-1 resistance, healthcare providers might consider increasing the dose of the medication, combining it with other therapies, or exploring alternative treatments, as well as highly stressing a clean and healthy diet, in addition to moderate to high intensity workouts. I will wrap up with this. Ozempic, Wegovy, and Semaglutide are all GLP-1s. However, as I discussed in the beginning, Mounjaro, Zepbound, and Tirzepatide are GLP-1s and GIPs. Sometimes if a patient is on only a true GLP-1 and they are GLP-1 resistant, switching to one of the GLP-1/GIPs may work better. And that would be Mounjaro, Zepbound, and Tirzepatide. So make sure to discuss the possibility of switching over with your healthcare provider. That might be exactly what you need to see better weight loss. I hope you enjoyed today's podcast. I'm Dr. Andrea Walker, family nurse practitioner and owner of Dr. Andrea's Medical and Weight Loss Clinic, as well as Telehealth DNP LLC. For more weight loss tips, follow me on Facebook or Instagram. I hope you have a fabulous week. Get some workouts in and don't forget to meal prep. I look forward to seeing you next week. Until then, take care.